Hello everyone, my name is Randy Palma and I just recently had a surgical procedure on my neck. It's called ACDF and ICBG. What it is on my neck they fused two levels, C5 and C6, because I'm having impingement on that level and also degenerative disc, which is called radiculopathy. I've had this for several years now, since I was a kid. I believe it probably started when I had my accident at the age of 11. And as I was getting older, I realized that, the pain had increased. And that's when I chose to see a doctor. About 10 years ago, I thought it was my ulnar nerve, because I had, on that accident also, injured my left elbow, and it may have impinged my ulnar nerve. At that time, we went through a series of tests, and that was in my early 20s, thinking that it was the ulnar nerve. I did a series of MRIs and also an EMG test on my left side and my left arm. The doctor eventually, back in 2000, ruled out that I needed to have an ulnar nerve transposition, which we did, but it wasn't successful. It did relieve a little bit of the pain on my left arm, but it kept the pain that I was having on my left shoulder and more on the cervical area too of my neck, right here in the back by the trigone, going all the way to my back scapula, under the armpit, and transmitting all the way to my left arm, top of my arm, elbow, and also my fingers. More on the thumb, pinky, and also all of it is numb. And it progressed, all throughout the years. Recently, about, I would say, 6 months ago, I had another bad fall. Or a little over 6 months ago, I had another bad fall on my bicycle. And it might have contributed also to the increase of pain that I had on my neck. I realized that then I needed to get another MRI done, because I was already getting sleepless nights and it was very uncomfortable to me. So we did another MRI, and on this study they have now shown an increase of the impingement on my C5 and C6 level. And also there is a central canal stenosis on that level, as well as a bulging disc and the radiculopathy, which is all causing the pain. We did another EMG test just to be sure that it's not carpal tunnel, and it showed that it isn't. So that's when Dr. Abshire and I, Dr. Abshire is a local here in Temecula who performed the surgery. We then opted to have this surgery done, and I agreed to it. That he was going to do a one-level C5, C6 ACDF, which is an Anterior Cervical Disk Fusion. And what he did was on the fusion, the plastic that goes in between the disc, he used an autograft, which means that he harvested a bone on my right hip, and that's the ICBG, which is the intercervical body graft. I am second day post-op already, and as you can see, the scar is right there, and I have very limited range of motion. I can do a lot of motion on the neck, and he didn't require me to wear the brace also, which is very good, because that, I heard, is very uncomfortable. There were also several talks about having a lot of pain on the hip. I'm not having any of that. Even after surgery, I didn't feel any pain. I only feel it when pressure is put on it. But other than that, there is no pain at all. I have no pain besides a sore throat. That's more of what I feel right now, is a lot of sore throat. I know that there's a lot of you out there that are very skeptical about having this procedure done. And if you were to ask me if I was to do it again, I would definitely do it again. The first feeling I got when I woke up was a big relief on my left arm. I don't have the same pain that I used to have in the back area of my scapula, in my neck, in the trigone area. It was very uncomfortable. I believe that almost every minute of my day was just so devastating. I would have to constantly move my body in a very irritable situation, you know, and I just felt so uncomfortable. My left arm was always numb. There was always tingling, you know, all throughout the arm. That's all gone now. I don't feel any of that. The feeling that I have now is more on the soreness of my arm. I think maybe it's because of the years of just readjusting and adjusting my situation because of the pain that I was always having. Sore throat, I'm hoping that probably it'll go away within a week or two, as I was told by Dr. Abshire. I will start my physical therapy on the 23rd, which will be about, 2 weeks post-op. I'm only on my second day today, and I'm feeling great already. I was very nauseated the first 12 hours after surgery, which I think is just normal response, from my body. But other than that, everything went smooth and it went great. For a lot of you out there who are worried about having this done, I would suggest that you probably have the MRI done first and do a series of tests before you finalize your decision on having an ACDF. I know it is a big surgery for a lot of you people out there that are thinking of having it done, but if you're just having a one level done, which is what I had, I don't think it's that big of a deal. My range of motion, as you can see, is still very good, and I believe that within a few weeks it'll probably even get better. I do a lot of triathlons. You can see some of my videos on YouTube. I have posted some of them. My last race was Carlsbad. I did okay, but not as well as I wanted to. I think it may have also contributed to the pain that I was already having on my left arm. I'll be doing more race in the future, hopefully within 6 months, as soon as I recover from this. But I highly recommend this surgery to anyone out there who's having the same pain as I've had. And I guess that's it. I'll be posting more videos of me in the next few weeks, just to let you know how I'm doing, and hopefully more power to all of you out there, and get well. Take care. Bye-bye.